Cerner is one of the most capable and widely used electronic medical record systems in healthcare, but it runs on a very specific set of workflow rules. When a medical billing team doesn't intimately understand that logic, claims get stuck and cash flow grinds to a halt. According to Kodiak Solutions, hospitals lost $48.4 billion to claim denials in 2025, driven by an initial denial rate climbing to 11.6%. For a $3 million practice, that 5% leakage rate means $150,000 lost every year. The software itself is doing exactly what it was programmed to do. The financial damage happens because Cerner's sheer complexity amplifies everyday human billing errors into massive, completely preventable losses. Claims do not deny themselves. While it is easy to blame the software, the data suggests most revenue loss stems from a persistent shortage of qualified billing staff. Data shows billing staff face a 33.3% annual turnover rate. Beyond a $50,000 base salary, adding benefits, taxes, and training means the true cost of keeping one in-house billing seat filled easily reaches $75,000 a year. Then there is the learning curve. A biller coming from another platform needs roughly 60 to 90 days to master Cerner's specific charge capture screens and denial work lists before they can produce clean claims consistently. During those 3 months, the practice pays a full salary for partial output. Accounts receivable days stretch out, claims are filed late, denials go unnoticed, appeal timelines expire. Relying on standard in-house recruiting for a highly specific electronic record system traps a medical practice in an expensive cycle of partial productivity. High-performing practices are stepping off this treadmill. Instead of running a continuous local hiring pipeline, they partner with specialized outsourcing firms like Staffingly to handle the revenue cycle. The critical advantage of this model is EMR-native access. Instead of relying on clumsy screen-sharing workarounds that introduce lag and errors, these outsourced specialists log in and work directly inside your actual Cerner environment. These remote teams arrive fully credentialed by the AAPC and AHIMA. They deeply understand CPT coding rules, ICD-10 guidelines, and specific payer modifiers. That certified human expertise is backed by AI augmented tools. Smart claim routing analyzes the billing queue and automatically flags high-risk claims for auditing before they ever reach the payer. Combining certified medical coders with native Cerner access and AI analysis eliminates the 90-day training penalty. Clean claims start flowing on day one. For practice managers and COOs, the greatest hesitation to changing billing models is the fear of disrupting daily operations during the transition. The onboarding timeline is built for speed. Secure EMR access is established within 48 hours, and the system goes live in 14 days. Leadership maintains complete visibility through real-time digital dashboards, tracking throughput, accuracy, and turnaround times. Strict safety nets govern the agreement. The service begins with a 14-day risk-free pilot program, followed by flexible month-to-month terms. If patient volume drops, you can scale the service down with zero long-term lock-in. This specific integration model shifts all training burdens, retention issues, and performance risks away from the medical practice and onto the vendor. When you place the financial ledger of an in-house team next to the specialized outsourcing model, the economic choice becomes obvious. A fully loaded in-house biller costs up to $75,000 a year. A Staffingly seat starts at $399 a week, roughly $20,748 annually. This yields a net savings of up to $54,000 per seat every year, reducing turnover to zero. This cost reduction happens under the strictest compliance standards in the industry, running under HIPAA Business Associate Agreements, SOC 2 Type 2 audits, and full HI Trust certification. The physical work environment is equally secure. Specialists operate from facilities with biometric access controls, clean desk policies, and disabled USB ports, guaranteeing that protected health information never leaves the controlled bubble. Ending the billing crisis comes down to the numbers. This model secures compliant, certified revenue cycle expertise while cutting traditional overhead by more than half. You can be live in 14 days,